the WHO Constitution states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. An important implication of this definition is that good mental health is absolutely fundamental to overall health and well-being. However, since last year, COVID-19 has adversely impacted mental health globally. It has interrupted essential mental health services around the world just when they're needed the most. To overcome this, many healthcare workers, leaders have moved fast and decisively to invest more in life-saving mental health. On these, one of these leaders is with us today to throw light on the topic mental health in the COVID-19 pandemic. Please join me in welcoming Dr. Rajesh Parikh, sir, Director of the Medical Research and Honorary Neuropsychiatrist at the Jaslok Hospital and Research Center. Our anchor for this session will be Dr. Girija Mahale, madam. She is a consultant psychiatrist and she heads the Symbiosis Center for Emotional Wellbeing at the Symbiosis International University. A little something about Girija ma'am. Dr. Girija Mahale is a young, dynamic, enthusiastic psychiatrist having diverse experience in subspecialties, including forensic, child and adolescent, community and consultation, licensing. After pursuing her MD in psychiatry from KEM Mumbai, she migrated to Australia, where she did her fellowship in psychiatry. Under her able leadership, she, with the help of young, dynamic psychological counselors, has developed the center that offers mental health services to all the stakeholders in the university. Even during the COVID times, the center continued to operate through telecounseling and telepsychiatry services, and in order to keep up the motivation of staff, conducted various online activities to help them relax in distress. Welcome, Girija ma'am. Welcome, sir. And I'd like Girija ma'am to kindly proceed with the session.
Thank you, Dr. Nabila, for the wonderful introduction. Indeed, I think we are all well versed with the pandemic and its effects, the detrimental effects it's having on all of us. I think we have experienced it for more than a year now, and through various social, mental, physical effects that is having on all of us. But to give us a very scientific perspective, we have a very distinguished personality here, Dr. Rajesh Parikh, who has joined us and given us his time to conduct this session today. I'm honored to invite Dr. Parikh and introduce him here today for this session. Dr. Rajesh Parikh is the Director of Medical Research and Honorary Neuropsychiatrist at the Jaslok Hospital. He trained at St. G.S. Medical College, KEM Hospital, and at Johns Hopkins University School of Medicine. He's also an adjunct professor of psychiatry at the University of Iowa, Carroll College of Medicine. He has over 125 publications in national and international journals and has received several awards. More recently, he co-authored the first book in the world on the coronavirus, What You Need to Know About the Global Pandemic, which again has been the bestseller and has been translated in more than 25 languages. He wrote another bestseller on vaccination in Jan 2021. He has won over 200 awards in activities as diverse as photography, painting, writing, and debating. He's presently even learning Sanskrit and Greek, in addition to 6 languages that he's already fluent in. Wow, what a diverse personality.
Hi, Rajesh. Lovely having you back here. We just spoke about a week back for the wonderful international conference on mental health, which Girija hosted to the Symbiosis Center for Emotional Wellbeing. And it is a delight to have you on board to share your views and the emerging role of importance of mental health. And I don't think so we could have got 2 better mental health professionals in Girija and you, Rajesh, to address this issue. And if you could also highlight the importance of mental health of students who are the future citizenry of the globe, so as to say. And Rajesh, you've been doing phenomenal work, the mathematical modeling and the predictors of exponential growth of COVID notwithstanding. It's always been a delight to learn from you. And for friends, Dr. Rajesh is the fairer. Generally, the husband introduces the wife as the fairer sex and my better half. But I would say that Firuza Parikh, an internationally acclaimed IVF consultant, would also be not hesitant enough to say my better half being Dr. Rajesh Parikh. So Rajesh, lovely having you on board, and all yours and Girija's.
Thank you
for the invitation.
Thank you so much, Rajiv, for your kind and generous words. And thank you, Girija, for your wonderful introduction. And also to the two of you for introducing me to this wonderful symposium that you're conducting. And I'm very impressed with the perfection with which you've been doing it. I've had two meetings, one to plan it and the other to make sure everything goes right. And I will try to make sure that nothing goes wrong in terms of adhering to my timeline so that you can get on with the validatory function at the end. Okay, so this is the global spread of COVID-19 as of yesterday evening. We can see that there have been 144 million confirmed cases. I want to emphasize confirmed. For every confirmed case, there are maybe two or three unconfirmed. And sadly, there have been 3 million deaths. Uh, let's go to the next slide. And now these are the slides I'm going to rush through to make up for my incompetence in screen sharing, but I'm sure you'll all know about this. So much has been written about it, about the structure of the coronavirus with its lipid coating, and that's why we use soap to get rid of it. And then the dreaded S protein, and that is the protein that enters the ACE2 receptor over here, and that's how it gets entry into the body. I think all of us know that it's a zoonotic illness, probably started with one bat in the wet market in Wuhan. Its incubation period is about 2 weeks, and the person harboring the virus continues to be infectious for 24 to 48 hours prior to symptom onset. Therein lies the danger that one can be asymptomatic and yet be transmitting the virus to other people. The R naught, as you all know by now, is the degree to which one person infects another. An R naught of 2, which means one person infects 2 to infect 4. We've probably heard the old story of the person who the king granted a boon to, and he said, all I want is 1 grain of rice on my board of chessboard, and on the second one I want 2, and on the third one I want 4, and all the rice in the kingdom could not fill up that chessboard. To look at another way, somebody has calculated that with an R naught of 2, it's just a question of 28 steps, human steps, from the earth to the moon. So it gives us an idea of how quickly this disease spreads. As we all know, most of the cases are mild. Only 15% are severe, 5% critical, and about 1% mortality. That's not to minimize the death rate. As we know, 3 million people have died. Men are at greater risk than women. We know the elderly are at greater risk, and those with comorbidity are at greater risk. This is how it is diagnosed with some tests, RT-PCR, blood tests, chest imaging, including X-rays, HRCT, and the symptoms with which we are all pretty well versed now. These are the ones I might focus a bit on when we talk about neuropsychiatric symptoms. And this is the latest data on the common symptoms: headache, fever, dry cough, muscle aches. These are the common symptoms. Here are the mortality rates, that if there is no comorbidity whatsoever, about 1.4%, 1 to 1.4%. And of course, if there are other conditions, cardiovascular disease, diabetes, hypertension, respiratory disease, cancer, then for each of these, the mortality rates go up. And sometimes, people with diabetes also have high blood pressure. They can have renal disease. So cumulatively, it adds up. And now we come to what I'm supposed to talk about. We're 3 minutes into this. I think we should be able to wrap it up in time. On flights, when the planes run late, the pilot keeps saying, and now with the tailwind, we've made up some time. So rushing through the other slides, I believe we've made up time. Now, these are not the waves that we hear of, the first wave, the second wave, the third wave. These are the waves when we're looking at the physical and mental health impact. So in the first wave, it's all physical, right? We all have to make sure patients are living. Then by the time we move forward, resources are restricted, and the non-urgent conditions get suppressed. Just a word on this. because so much of focus is on COVID-19 that we forget the other diseases are not going away. About 10 million people die of cancer every year. 18 million people die of cardiovascular diseases. About 3.5 million people across the world die every year of HIV, malaria, tuberculosis. And sadly, almost 1 million people take their own lives. Now, all this is going on simultaneously, but is currently being neglected. And then, there is the impact of interrupted care on chronic conditions, the ones that I just alluded to. And then finally, people start looking at the psychic trauma, mental illness, burnout amongst healthcare workers, economic injury. And this is what the director of the WHO's mental health department had to say. She's called mental health issues a parallel pandemic. And some have even gone so far as to say that the next big pandemic is going to be mental health, and we shall see why. So this is data, research data, and I apologize if the references are small, but I'm sure for those of you who are interested, there will be a way to get these slides across to you so that, if you are interested in mental health and research, you will actually get all these references. Research in 78 countries has shown 11% of the population stressed, depression in 25%. Many countries, do not have the facilities for mental health research. And of course, it's not their priority currently. And in China, various studies have shown from 7 to 54% of the population having psychological distress. These are the earlier studies, and these are the more recent studies. And PTSD, it's something we see long term. We won't get into that right now because I'd have to discuss it with you. And in Europe, 36% of the population reported moderate to severe psychological impact, 25% anxiety, depressive symptoms, 41%, stress, 41%. For those of you who are not in mental health, just to give you an idea, these are 4 to 5 times the rates of what you encounter in a normal population in a cross-sectional study. And we do have data from India, a lot of it from Nimans in Bangalore. And we see, again, based on the studies, a 33 to 74% psychological distress in the population, depression and anxiety in almost 41%. I mean, these are huge figures. And then, there's something interesting here that 80% of people felt the need for professional help from mental health experts. That's bad news, of course. But good news is one thing that the pandemic has brought in is it's destigmatized mental health. At no other time would 80% of our population be ready to recognize and take mental health from experts. And now, during the current second wave, you can see that the anxiety figures are going up. 51% in China, depression 41%, and you call it PTSS or PTSD depending on the time duration, and they're more or less the same. The time is the only variable, and 33.6%. And then you have another study in Switzerland showing stress, depression, and the other consequences. I think I rushed through that slide. What happens pre-pandemic and what happened during the lockdown. Keep in mind, Switzerland has not been terribly affected. And in the UK, between July 19 and March 20, I am sorry, I managed to advance that, I think. Yes. So between July and March, 10%. In June 2020, it's almost doubled. Look at it in the US. Between Jan and June, in 2019, 11%. By December 2020, 42% showing mental stress and symptoms of anxiety or depression. What are the vulnerable populations? Who are the ones we have to worry about the most? Now, we've heard a lot about how children are insulated somehow from the virus. Not so much so during the second wave with its mutant strains, but earlier at least, they rarely contracted the disease, but they're not insulated from depressive symptoms, from anxiety. In Italy and Spain, both severely affected. Look at the figures. 86% of parents reported changes in children's emotions and behaviors during the quarantine. And, this is understandable. I mean, children love to play all the time. It's in their inherent nature to do a lot of masti, to be with other children. Many of them enjoy school for these reasons. And now, they've been isolated. So this is mental health is affecting the children a lot, although the virus may not be affecting it so much. And in the elderly, who anyway are affected by the virus, some studies have shown lesser anxiety relative to younger age groups, but longitudinally, loneliness, social isolation naturally increased during the pandemic, and so does their anxiety, depression, stress. Now we come to the neuropsychiatric aspects. So a US study, which was published online in Brain Behavior Immunology, showed that 22.5% had neuropsychiatric symptoms. In a UK study, 91% of the cases are new cases. These are not people who are having either a relapse or a recurrence or even an increase in their symptoms, but people who have not had mental health issues earlier. And then, lack of smell, lack of taste, other neurological conditions. GBS stands for Guillain-Barré syndrome. It's a complicated thing known to occur with other viruses, but fortunately not so common. And then, of course, there's also a syndrome that occurs in patients who have got out of the ICUs. Now, keep in mind that these are patients who are usually very severely affected. And so they've been hovering between life and death for a while. And in the ICU, the isolation is even more intense than it is in their homes. The lights are on all the time. Patients get disoriented between daytime, nighttime, and then there are other people dying around them. So it's understandable that post-ICU patients have a higher prevalence of mental health issues. We won't get too much into treatment. Suffice it to say, there is no specific treatment for these mental health issues. I mean, pharmacological treatment. There are other things, of course, that can be done in counseling. And what is the Indian data? Now, this is an interesting study done by Damodaran Dinkaran of NIMHANS, and it's an early study. And they have showed that in the Indian population, meningitis, seizures, Guillain-Barré, polyneuritis, and a lot of this whole spectrum of neuropsychiatric illnesses is known to occur. Now, here is something interesting. Lately, there have been reports of people who have had no psychiatric illness, either before the pandemic or before or during the infection, but who 6 months later, 6 months after having recovered, show psychosis. This is a New York Times report, 22nd of March, on one individual, but there are other studies as well. We've all been hearing the term brain fog. We never used this term, as Dr. Malay would agree with me, in the past, but now lately everybody talks about it. And this is just disorientation, confusion, and along with that, loss of memory. There have been incidents of impulse control, meaning people suddenly getting violent after recovering from COVID-19. So various changes in the brain causing neuropsychiatric symptoms. Now, post-COVID-19, anosmia, lack of smell persists for a long time, as we're all aware. And so newer treatments are coming about. Newer treatments are being evolved, which didn't exist before. One of them is a kind of physiotherapy for smell. It's 4 cents are given, you're told to associate memories. And it showed that 90% improvement in 6 months, at least in these 2 studies. Why do the neuropsychiatric symptoms occur? Viral infiltrations into the CNS. It's easy for the virus to gain access to the brain, from the nerves of smell and from the nerves of taste. And then there's another theory which says immune cells migrate and cause it. So it's an autoimmune condition. And even some studies, the latest thing is on food. I mean, the gut microbe and all that it does, and they feel that the dislocation of the microbes, or rather a translocation of these microbes, causes some of these symptoms. Many theories. It'll take a while before some of them are disproved and some of them are confirmed. So what lies ahead? We must keep in mind that the current situation is dynamic, fluid, and unpredictable. So it's changing all the time because the virus is mutating. We must always be humble and remember that we are always 2 steps behind the virus. And the other day I was giving a talk somewhere and I said, look, here's the problem. The virus is mutating rapidly. Our thinking is not mutating. We are stuck in our old theories. We are stuck in our old behavior patterns. And as long as our thinking and behavior is not as flexible as the virus, it'll keep moving ahead of us. Once somebody asked me, would you therefore say that experts not knowing everything about the virus or being too specialized is like the old parable of the 6 blind men and the elephant? And I said, to an extent, except that the elephant is running instead of being stationary and is sometimes becoming a tiger and sometimes becoming a lion. So, we are 6 blind people chasing an animal that is changing shape. But given that, I think we have to be very proud of what science has accomplished so far. So, therefore, because of this fluid condition, this dynamic condition, our psychological predictions will hinge on what we have learned from large-scale disasters, from previous experiences, and also from this pandemic in different parts of the world. But quickly, let us take a look at what we can learn. Lord Byron once said, the best prophet of the future is the past. And meta-analysis of studies done during SARS and MERS, which are fairly similar coronaviruses, has this data to show. So, and some of this has been there for up to 3 years after that infection. And now there's yet another thing we have to deal with, and that is the grief crisis. Worldwide, there are 3 million deaths, but 12 million people who have lost somebody. And they are now showing signs of complicated grief, prolonged grief which goes on beyond 3 months. Normally, you expect grief to go away within a few weeks. But people who are unable to get closure into what has happened and continue to grieve, and that's going to be another population that's going to require a lot of attention, because prolonged grief has been linked to sleep disturbances, blood pressure, anxiety, depression. What can we do? It's very important to screen for mental disorders in all settings to the extent that we can. We have to foster healthy coping mechanisms in society in general. In 1994, I was part of a team that went and looked at the mental health consequences of a natural disaster, the earthquake in Latur. We went to the village of Kiladi, and where 10,000 people had died. And we were surprised at how well some people were able to use their inner coping mechanisms to deal with these issues. We have to continue to advocate both for physical health, because there's tremendous inequity in our country and across the world, but also for mental health. And, some people suggest that one should limit exposure to distressing news, because, television doesn't show you the 90% of people who just go through a mild episode and don't experience any physical distress. But you see images of crematoria, images of ICU, and watching a lot of that gets people's anxiety increased. This has been shown in studies across the world. What are the lessons? This is the second last slide. What are the lessons that we could have learned? The most important lesson, even more than our mental health lesson, is that we are only as safe as the weakest among us. We should never forget that this pandemic started with one individual in one wet market in one city. And from there, it has terrorized the world. So, as long as some of us are unsafe, all of us are unsafe. As long as somebody in a village in Africa doesn't get vaccinated, this thing can come around. So, again, our whole thinking about healthcare has to change. The virus doesn't respect GDPs, it doesn't respect military arsenals, it doesn't respect national borders. We have to think of one world when it comes to health. We have seen that politics, power, money cannot save us from a pandemic, but science, research, frontline workers who are willing to risk their own lives to save the lives of others can save us. My last slide after this will be a tribute to the 12 million healthcare workers who have been infected. Then we have learned that technology is important. It's here to stay. It is present and future. And of course, nations will have to be self-reliant now, because when pandemics of this nature occur, and this is probably not the last one, then borders get sealed. And so, as you're seeing in the case of oxygen, we exported a lot of oxygen in January, February, but now we don't have enough. We have to import it. So that's what we can do, become self-reliant in some of this. And at a slightly deeper level, the pandemic has given us the opportunity to ask ourselves what is truly essential. We hear the words essential services all the time, but at a personal level, we can sit back and ask ourselves what is essential. Is our work important? Is the next promotion very important? Is our paycheck very important? Of course, they matter. But for many of us, these have been the priorities in life. And the pandemic has given us an opportunity to realign, to reprioritize our lives. For many now, the friends they miss, the family they miss, the personal sense of peace, calm, happiness are the essential things in life. And that is what the pandemic has provided. I have enjoyed talking to you, and we will have the promised 15 minutes for question answers, because I'd love to hear your views, not just your questions. And if we cannot cover all the questions, please email them and we'll send them.
So, sir, we have received a couple of questions which I'll direct to you. Some of which you've already answered through a previous presentation. But what I'd like to ask you here is, how do you think the pandemic has affected the mental health services in India? Or has it had an effect on the mental health services?
I'm not sure of how much of an effect it has had in terms of straining the mental health services, because I have not come across data on it. I would imagine that it has stretched the mental health services, but our mental health services were never adequate in the first place. So some time ago in a talk, I thought of this during a talk. It came spontaneously, and I mentioned this. And I said, you know what the pandemic has done? The virus has turned the microscope on us. The virus has exposed our own weaknesses, cracks in our system, which we had glossed over, which we had not acknowledged earlier. So our mental health services are always overstretched. Just to give you an idea of scale, we are about, say, 5,000 plus psychiatrists in India. There are 7,000 Indian psychiatrists in the US. There are more Indian psychiatrists outside the country. I just gave you the figures for one nation, than here. And most of us are in urban areas or semi-urban areas. So in rural areas, they've been grossly underserved. And the pandemic has highlighted that now. So in that sense, perhaps some good will come out of it. People will realize the importance of it. The other change that I see is how ready people are to accept mental health diagnosis and seek mental health help. And I think technology has done a tremendous job of facilitating that. Almost all of my practice is online right now, and I'm astonished at how well people have adapted to it. And I'm a little surprised how I've adapted to it too, because until a year ago, I didn't even own a cell phone. Today, you saw how I struggled to get my screen sharing up. So, I am technology challenged, and we've all adapted to it. So I think the change that will come out of this will be enduring and will be good for mental health services, and of course for people who want to avail of the services.
Yes, thank you, sir.
I don't want to ask a question. I want to comment.
Yes.
Rajesh and his wife Firoza are very dear friends, but I only knew them as friends, and I didn't know Rajesh was such a wonderful speaker and an orator. And not just the speaking abilities, Rajesh, but I think the content was phenomenal. And right now, I invite you to give the same lecture to all our faculty members at Symbiosis, because it's something which was very much needed. What I'm glad to know about is that there is a dearth of people, in India, when you give the statistics of how many psychiatrists are there. But through the Symbiosis Center for Emotional Wellbeing, what we are planning to do is to start some programs in community mental health. And do you think, as a very senior psychiatrist, that such a program, of course, we all know it is needed, but do you think it is possible for the non-MBBS people to take such a program, and we could create a cadre of the way a cadre of medical technologists have been created now. We never thought that X-ray machines and CT scans and MRIs could be managed by medical technologists a few years ago. They were only radiologists. So likewise, can we now have community mental health workers, as you very rightly said, who can work in the rural areas, who can work in the communities, and will that serve the cause of having more support for mental health?
It will be an incredible service. It will be path breaking to a great extent. I have some experience in it, but there are people who have more experience than me. Dr. Srinivas Murthy comes to mind, who set up a beautiful community service around in Bangalore. Vikram Patel comes to mind. He has done a lot of work around Goa. I was on the WHO as a representative for Southeast Asia some years ago, and we planned all this. We planned, but that was more for awareness. It wasn't that focused on service. But there are incredible things happening now, Vidya. There are amazing things happening. There are artificial intelligence programs which can help in therapy. So, it's a very exciting field, and Symbiosis, I know, has always been in the lead. It has always been a pioneer in education and in healthcare. So, if you are going to stretch yourself in this direction, I think it will be an incredible service and could actually become a model for countries, for other countries to do. And today with technology, it's actually much more implementable than it was, say, 5 years ago. So thank you for inviting me there. I can't wait to come to Pune and, to see the amazing institute that your family has created from scratch. And I know how well you're serving the community. This will be one more step, I think.